By 2030, 1/3 of American prisoners will be over the age of 55. This is according to a Pew Research paper. And according to that paper, older prisoners cost an average of $70,000 a year in health care costs alone each. That is 3 times younger inmates' annual health care costs. Is it time to make the tough cuts? Joining us is Dr. Sreedhar Potarazu, CEO of Vital Springs Technologies, and Kendall Coffey, former U.S. federal prosecutor and founder of Coffey Burlington. Thanks to both of you for taking the time. We appreciate it. Sreedhar, let me start with you. Do we have to make the tough choice to not provide health care to older inmates?
We're going to have to make some really tough choices. This is ridiculous. We can't even afford to pay for the people that are not in jail, who are the elderly, let alone the people that are incarcerated. So we need to draw the line in terms of how long we're willing to support these folks and come up with a transition plan in terms of how we're going to entrust more responsibility and maybe get them out early back into society and get some other means. The states and the counties don't have the money to subsidize this percentage of elderly people and the numbers that you've just mentioned.
Kendall.
Well, I mean, we decided back in the 80s that we wanted prisoners to be serving decades. Remember the olden times, the bad old days when people would serve 30% of their time? We wanted them to be serving their whole prison sentences, so we shouldn't exactly be acting like we're shocked to find that there are geriatric prisoners in this establishment. And once we've got them, we are responsible for them 24/7, 365 days a year, and that means health care. So it's a cost, but everything about the criminal justice system has a cost, and if we want justice for the victims, then we're going to have to continue to warehouse these folks. And if we're going to warehouse them, we have to make sure their medical care is taken care of. Expensive as it is, justice isn't always cheap.
Kendall, let me ask you this, though, for some people, people watching and Americans across the country who have been law-abiding citizens, are now older and are unable to afford health care and have to not get the medicine or not get the dialysis treatment that prisoners get at taxpayers' expense. How is that justified, not legally, ethically?
Well, ethically, it's a tough one in the sense that my father's 89. He's a World War II veteran, and believe me, he doesn't get anything like the money spent on his health care that some of the prisoners do. But what we did is we made a decision that we wanted prisoners to be serving a very long time. The doctor made a good point. Maybe there should be more consideration to geriatric parole or other kinds of release. But in the meantime, what is anyone suggesting? That we stop treating people who are in prison, can't do anything, can't be reached, can't be touched, that we let them die simply because we as a society don't want to pay for it?
All right, Sreedhar, is that what you'd be suggesting?
No, I'm not suggesting we let anybody die, but I am talking about a common problem we have over and over again is we can't write a blank check just because we signed up to it in the 1980s. It's the same mentality over entitlements. Just because we approved Medicare or Social Security in 1965 when we made mistakes then and didn't figure out how we were going to pay for it doesn't make today correct. Today is insolvent, and we've got to come up with the means of creating a solvent program that becomes sustainable for states and for county governments who are having to bear the burden of this.
Sreedhar, let me just read something to you. It was interesting. In the Birmingham News editorial board wrote an op-ed this morning, and they said there is no easy answer to bringing the costs down. The solution certainly isn't, as some reader is certain to suggest, to skimp on inmates' care. They continue to say the state can and must be more judicious about whom it sends to prison. That they're saying the problem is we're putting too many people in jail.
Well, you know, that's going to be part of a judicial problem in terms of the thresholds of who we're committing to incarceration. But what I can tell you is that perhaps some of the services that are being offered are not going to be offered as promptly as one might need. There are going to be emergent services that inmates are going to need just in time, but maybe some of the more elective procedures, they're going to have to wait.
Kendall, let me just ask you a quick question on that front before we go. What about the story of an inmate getting a new heart or inmates getting dialysis ahead of regular citizens? Are there places where you would start to say no?
It's very, very tough because I think if we really want to save money, ultimately there's the option of trying to let them die and putting their health care at risk. There's also the option of letting them go. That has a huge political risk. But we're in a time where one kind of tough choice or another has to be made.
Right. Well, on that note, I think we all agree. The question is obviously the legal and ethical difficulties of which choice. Sreedhar, Kendall, thanks so much to both of you. We appreciate it.